Great pleasure to actually introduce Heather officially tonight, and to invite her to say a bit about her recent experiences that she's going to share with us tonight. Heather comes to us with a personal experience in childhood cancer, having navigated a diagnosis of neuroblastoma with her daughter Evelyn from 2018 to 2020. She has a huge heart for advocacy for better treatments and mental health support for childhood cancer patients, survivors, and their families as both a person with lived experience and a professional. In April of 2020, Heather went back to university to get a degree in behavioral sciences with a focus in psychology and is currently in her last year of her Master's of Social Work at the University of Calgary. She has a particular interest in the mental health and well-being of children, adolescents, and their families. Heather has been the recipient of several awards, including the prestigious Queen's Platinum Jubilee Medal for her betterment of the province of Alberta, where she currently lives with her family. So welcome to Heather, and thank you so much for being with us tonight, and over to you.
Thank you so much for having me. I'm looking forward to sharing my experiences with everyone. And so I think my first slide is kind of all been covered at this point. So I'm a mom, I'm a wife, I'm a social work student, I'm an advocate, I'm the executive director of a nonprofit called Radflix. Those are, I think, the titles I hold closest to my heart right now. They're not exclusive to all the titles I hold, but they're the ones that feel the most notable and important to me at this time in my life. So before I get started, I think I'll just share quickly. So we are the Roys. So it's in this picture here is my husband, Mike. My daughter, Evelyn, is the one who Mike has his arm around, and our little Harper is the one sitting or standing just in front of me. This picture was taken. This is such a treasured photo to me. This picture was taken. Evelyn had already been diagnosed with cancer at this point, and she had had surgery to remove a primary mass tumor and a central line placed, and had been through her first round of chemotherapy, and her hair was starting to fall out. And we had these photos booked as our annual photos that we do every year, and they were booked even before we knew she had cancer. And Ev had been admitted to the hospital, and my heart was just suffering that we weren't going to get our annual family photos. And thankfully, our doctor let us leave for the day and get these photos, which are so treasured to our family. For me, this was my first kind of exposure to the importance of psychosocial care. So the doctors recognized Evelyn as more than just a patient, but as a person and somebody inside our family, and that our whole family needed care in that time, and that they prioritized us being able to go out and get these photos. And, they were hard to do. Evelyn was in a lot of pain, but they created a beautiful memory and time for our family. And they're something I'm so grateful to have had, and also have had that exposure to the importance of caring for the whole family and for things outside of the walls of the hospital. So let me tell you about my beautiful Evelyn. So Evelyn was born in 2008. She was born in a very trying time in our lives. She was born when my husband's father was in renal failure for cancer. He passed away shortly after she was born. Never did we imagine that 11 and a half years later she would join him. Ev was brightness to our lives from the moment she entered our family. She was a happy, babbling baby. She was bright-spirited. She was delightful, easy to be around. She had a giggle that never changed from the moment she was born until the day she passed away. Ev inspired us in so many ways. So the reason why you'll see sunflowers scattered throughout this presentation, including in this photo with Ev, is that we always told her, even as a little girl, that she was like a sunflower because she always knew how to find light. But what we learned as she got older is that she became so much more representative of a sunflower than just someone who was able to find light. She found another really important piece of life, and that is how to lean into others when it's dark. And that's what sunflowers do. When there's no light, they lean into each other and they absorb each other's energy, and they take care of each other while they get through the darkness. And Ev was so good at doing that. She was so good at absorbing light and giving light. And so we feel immensely proud to have got to parent her and to get to continue parenting her through her legacy. So much of what we do now is built off of the things that Evelyn talked about when she was in treatment, the things that Evelyn saw there was gaps in the system and the spaces we felt we could fill for her. And that's why we're so involved in so much of this pediatric advocacy, because without advocacy, you don't have the ability to fill those spaces. And so, inspired by Evelyn, we as a family have really focused on pediatric radiation. And the large part of that is because in pediatric radiation, they're going to an adult facility, and a lot of people are unaware of that. And because people don't know kids are going there, they're not giving resources into those spaces. But our kids deserve to have the same access to resources and care when they go for radiation than as they have at the children's hospital. So that means they should have access to art therapy, music therapy, child life specialists, proper distraction tools, trauma-informed care and support. The other thing is Evelyn was always very concerned that her sister Harper was well taken care of. And so this is another reason why we advocate for the whole family care, because our experience and the experience of so many that we talk to is that the patient was very well remembered. Mom is usually pretty well remembered, dad moderately so. The siblings are very often forgotten. And through Evelyn's inspiration of always ensuring that Harper had a place and felt included and felt important, we continue to carry that on to ensure that siblings are remembered in all of these spaces as well. So I had the privilege through ACCESS of attending CAPO, which is part of that advocacy piece for me, because learning is one way you can advocate or learn how to advocate. And so CAPO is the Canadian Association of Psycho and Social Oncology, and they have an annual conference every year. And this year it was at the end of April, and it kind of rotates around, but this year it was in Toronto. So I applied for this scholarship and was able to attend or grant, which I'm super thankful for, because CAPO is a conference that um, not only brings together professionals like researchers, psychologists, child life specialists, social workers, nurses, etc., but they also bring in the others. And the others is what's so important to people like me, because that is, I am an other. I am a caregiver. It's a very inclusive space for people who are caregivers, for patients, and they want to hear from us. They want to learn from us, and they're very respectful of people who are coming from those other spaces, and knowing that our lived experience largely helps inform the work that they're doing. And they want to use that knowledge to create better spaces for people. So CAPO, psychosocial oncology, is largely dedicated to that sort of psychosocial, so emotional quality of life, that sort of thing. Those supports are what they focus on, that they find the most important. And so a lot of these people are working in these spaces to improve through research and through programming the betterment of all the things outside of treatment that a patient or their family or caregiver may need. So my experience at CAPO was fantastic. This is my third year attending. I've always kind of had to find my way there, and this year I wasn't going to be able to do that between costs of school and family life and etc. So ACCESS being able to get me there meant I was able to present, connect, and learn. Where I wouldn't have necessarily been able to if it weren't for their support. So I've kind of touched on this already, but I had a very safe, inclusive experience. It was filled with a ton of knowledge. So I presented as part of a project that I've been in that discusses the importance of bringing caregivers and patients into research. So I got to present that with a PhD doctor out of Newfoundland. And so Sevtap is her name. So Sevtap and I talked about why it's important from both a research and from a caregiver patient perspective to include people like me, people like Evelyn, in research when we're looking at oncology care and treatment. And one of the largest themes that came out of that was that idea of hope, that idea of validating experiences for people on both sides of the fence, and the idea that when we create community, we create better care. I was able to connect with a lot of really amazing people there, both people like me, people who were professionals in the field, and kind of everybody in between. And that opportunity for connection is always so important, because I think again, it's similar to what I presented on, is that idea that it really validates the experience for everybody, that we're all focused and learning together and trying to build better spaces for patients and their families across our country, and even from an international perspective, because there was international people there as well. It's a Canadian focused conference, but there is people from all different spaces attending, and being able to connect and see and hear what people are doing across our country and beyond is just really fantastic and really special. And the fact that I felt so included, I think is very significant. And I would encourage anybody who's listening, if you're ever looking at attending a conference and think, oh, there's not a space for me because I'm not a researcher, or I'm not a doctor, or I'm not a nurse. There is a space for you. And not only is there a space for you, but people are really eager to have someone like you welcomed there, especially through CAPO. So I would encourage you to seek those connecting points as well. I was able to learn in a lot of spaces. I tried to attend a large variety of sessions. So I tried to avoid going to just the ones where I felt like I was comfortable. So I was able to pull a lot of knowledge from there. It's very interesting to hear about where research is going, what research is doing, how our current global state is impacting research, especially in pediatric spaces, but across the board. There was presentations from podcasters, there was presentations from palliative care teams, there was presentations from social workers. There was very fascinating information that even gave me insight into my own personal experiences that I hadn't quite been able to piece together or put words for. So one of those in particular was through a poster presentation through a researcher who's from the Swallow Lab, and they're actually in Toronto. And one thing I've really struggled with in my grief is I often find my food gets caught in my throat. And I just thought it was like this weird thing. Maybe I'm getting old. I didn't know. But in actually talking to these researchers, this is actually a common, like emotional trauma-based response that you can struggle to swallow after going through experiences like what we've been through. And so even just getting that bit of knowledge and insight there was so fascinating for me, and has opened up doors now to my own sort of healing and processing. So on top of learning from an academic perspective, I also learned from a personal perspective. I was also able to attend another session that really impacted me, was a session on palliative and bereavement care from the palliative team at Princess Margaret, and to hear about the programming they're doing, the family supports they're putting in place, the annual gatherings they have. It was really, really remarkable. One thing is for us, our family, we've participated virtually in sort of some bereavement care memorial programs out of Sick Kids, because that's where Evelyn passed away. Even though we're Calgary based, we had been in Toronto for treatment when she passed away. And in this session, someone made a comment about how it's really important to be able to bring people physically together because you don't have the same experience in a virtual. And I was able to, as a caregiver, as a person who has leaned into these experiences and had both virtual and in-person memorials that I participated in, able to say that the heart is still there, the connection in the community is still there. And I think for people, especially researchers, to hear that really opens up a door of opportunity for them to be able to depend on a broader variety of programming. And because of my speaking up and my sharing my experiences, they came and spoke with me afterwards, and they gathered more information, they gathered more knowledge. which really highlights for me the importance of it not just being professionals in spaces like this, that they really are wanting to and being informed by caregivers and patients. So for me, and I've touched on this a little bit already, but why does advocacy matter? Well, for me, advocacy has given me a platform to make meaning from our experiences with Evelyn. It's given me a space to find healing in action through creating change. It's helped me to work towards filling gaps in the system that we experienced. Um, to provide better care and support for patients, but also to provide better care and support for the caregivers, to provide better care and support for the professionals in those spaces, because I think it is a more holistic approach where everybody can and should be working together and honoring and supporting each other's experiences in the spaces that they're coming into this from. And so advocacy for me is the strongest way that I can do that. And it is through storytelling, it is through learning, it is through attending conferences, being on social media, kind of engaging in a variety of different spaces. But my hope in that when I share these things is that it shows other people that regular people can advocate. You don't have to be in these big fancy positions with a bunch of letters after your name. Anybody can step forward and do this. So my heart beats for advocacy, both personally and professionally. As I move into the space of being a social worker, I'll carry our personal experiences, I'll carry the experiences of learning. But the biggest reason why my heart beats for this type of advocacy is because of the two girls you see on this page here. So it's Evelyn and Harper. This is taken from a hospital bed. And when I see those big bright smiles, I see that those were girls who were well loved and well taken care of during very dark, very hard, trying, difficult times. And if it were not for somebody who had stepped in before me to advocate for things like child life specialists, music therapists, art therapists, video game programs, special training for nurses and doctors and etc., my kids would not have carried the smiles that they're carrying in this photo. And so this is the piece I always come back to, is that even from a hospital bed, my girls look so beautiful and so bright-eyed, and it's advocacy that was able to maintain that for them. And so I feel this great responsibility to be able to follow in behind the people who have led these spaces before me to ensure that the next set of kids have these big, bright, beautiful smiles in these spaces. Um, this has a lot of text on it. I hate slides with a lot of text, but I just knew I wouldn't get through everything I wanted to say if I didn't have it all in there. So, again, I just want to reiterate and encourage you, if you're ever thinking about attending a conference or speaking up or starting an Instagram account or really just like meeting with doctors, any space that you feel safe to share, please do it, because anybody can be an advocate. And some of the reasons why you can and should be an advocate is, as I mentioned, that healing through action. So taking part in advocacy can really help you to process the experiences you've had, and it can transform those experiences into meaningful change. For me personally, that's where I found my largest amount of healing, was through stepping into these spaces and kind of that healing through action. It's the most important part, I think, of my grieving process. So that's why it's up at the top there. That community and connection, I think it takes a village. It takes a village to get through anything in life. But in particular, when you are going through a crisis, a village is really, really important. And so that kind of community and connection of advocacy, it's creating support networks with people who are understanding all of the challenges that are involved in something like cancer. So, we all know that everybody kind of knows there's these emotional and medical challenges. One of the things we were most surprised by was how many financial challenges came with this type of medical crisis. So, we were a two-income family that on a moment's notice became a one-income family, and we added about $1,000 to $1,500 a month in medical expenses. We think because we live in a country with socialized medicine, that there isn't going to be that financial toll, but there really is, because we're paying for parking, we're paying for prescriptions outside of what our medical or benefit costs are going to cover, dressing supply changes, mobility aids, um, food you have to eat, and they're not feeding parents or caregivers in the hospital. Coffee is essential to life. So being caffeinated is necessary. And so, like, these financial things all add up really, really fast. I mean, one of the things I say, I'm not sure what it is, the cost is per province to province, but in Alberta, right now, it's $74 a month to pay for parking at the hospital. And you are not there because you want to be there. But you still have that cost associated to it. And then you add in, $10 or $15 for a meal in the cafeteria because your 30-minute blood work appointment turned into a 5-hour appointment because you needed platelets, or a 1-day admission, or in our case, sometimes a 30-minute appointment turned into a 5-week admission, and so there is a lot of financial burden that comes with that. If we don't talk about these things, people don't know that these are a thing cancer families are going through. Without talking about it, without knowledge, then people don't know that a great way to support a family is with fuel cards, with parking costs, with grocery gift cards. A lot of times, especially, and forgive me, I speak so much about the pediatric space. That's where my largest amount of experience comes from. But a lot of times we think we should bring our kids toys. As adults, I often hear it's like fuzzy slippers and coloring books. They don't need any more fuzzy slippers and coloring books, but they sure could use a $100 fuel card. And I think if we don't talk about these things, then people don't know. And that's what advocacy is talking about it, sharing your lived experiences so that somebody else can learn. This increased awareness is so important because it's bringing public attention to the needs of families and patients who are experiencing this. But beyond that, that advocacy also can encourage things like early detection, promote understanding of not only what a patient is going through, but what their families are going through. Sharing personal stories that humanize statistics, I think, is so critical, um, because it's humanizing it. It's exactly what I've written, right? So humanizing it for people is really a way to persuade donors, to impact policymakers, to get organizations involved. And that's where change is going to happen right from the base level core of a system. You as a person with lived experience, know firsthand what does and doesn't work. And again, I say in pediatric cancer care, but this is across a broad spectrum of spaces. You know what works from diagnosis through treatment, survivorship, or palliative or bereavement care. You are the person who's lived it. You are the person who should be informing what people need in those spaces. So that input that you are giving is going to guide policy reform. It's going to provide things like better insurance coverage. It's going to enable clinical trial access. It's going to create care plans. It's going to remember that a patient is a whole person, not just a person we're working to get better. And I think so often in cancer, when we come into these spaces, we become very hyper-focused on healing. But we forget that person doesn't just need chemotherapy, radiation, surgery. They also need mental health supports. And so does their caregivers, siblings, partners, children, spouses, anybody that is in that inner circle of that person needs care plans as well. And without advocating, without sharing these stories, people don't know that. So that push for like patient and family-centered care, to ensure that holistic care, whole needs are being taken care of, is really ties it back over into why something like attending CAPO is so important, because that's their whole focus, is what is that psychological, social care for people? What do they need in order to survive this, not just physically, but in the way of a whole person surviving it, so their mental and emotional care as well. Um, that's it. I made it to the end. Thank you so much for having me and for giving me the space to share. I am open to any sort of questions and comments thoughts you have, and certainly happy to be connected with people who have questions about attending conferences or being in spaces. And again, thank you so much to Access for creating this opportunity for me to be there, because without you, I wouldn't have gathered as much knowledge or been able to share as much as I was this year. So I'm really, truly grateful and thankful for that. I think I can stop sharing and
Thank you so much, Heather. For anyone who's on the call, if you have anything that you would like to share or ask Heather, please feel free to raise your hand and we can give you the opportunity to speak. But Heather, thank you so much for sharing. Thank you for expressing everything you expressed. It's so important for people to hear, and it's very much appreciated. I guess I can start by saying I think it's great that the experience you had was so welcoming and so open to persons with lived experience. I think as a community, we're trying to see that happen at more conferences and at more meetings more and more. And there's a movement, let's call it, towards that. I think that there's a lot to learn and a lot to be gained in certain areas. So some of that advocacy you're talking about, I think, can continue in opening it into more of these spaces to make it a regular part of a conference and a regular part of that support. So I'm very happy that you had that experience, at least at.
yeah, and I acknowledge that that's maybe not the experience of every space, but I think that that's why places like Capo are so important, because they're opening up that accessibility for people, and hopefully leading by example then for other organizations to see like there is safe and inclusive ways to bring in people like me, and by doing that, then hopefully it's opening the doors for more people like me to feel like they can go and attend and be a part of these spaces.
Absolutely. John.
So Heather, thank you so much for this. Honestly, I was sitting here sort of listening to your talk and looking at your slides and thinking, wow, I really need to recruit Heather more to work with us in education and training, because this is exactly what we're trying to do, in the education and training theme here within Access. Is basically, groom people to do exactly what you're doing, right? And to go to these opportunities and grab all of the knowledge and, then come and share it with others. So I really, really appreciate, what you've done. So you talked about earlier about presenting. I think was you had three different sort of things that you did while you were there,
Yeah.
but essentially presenting. Do you want to talk a little bit more about what it is that your sort of role was in terms of presenting, or what the topic sort of area might have been? Or did you mean that in the context of you were in many rooms and you also got to present your story?
No, so I am part of like a national project that is a focused on reducing silos in research. And their focus when they're talking about reducing silos is how do we bring patients and caregivers in? How do we incorporate nurses? How do we incorporate doctors? How do we incorporate so that there is this sort of multi faceted way of doing research with very many faces in front of that. And so that project is one that I've been a part of for over a year now, about a year, no, closer to 2 years actually. And so we meet regularly and we discuss kind of what's happening in research, how people can be engaged, and then again, how are we reducing those silos to bring a broader voice into them. And the people that are a part of that are people with lived experience, people who are researchers, people who are, there's social workers, nurses, there's some doctors, both pediatric and adult care in there. And so as a part of that group, we've now done research ourselves as well and created a presentation that we did at CAPO this year, and I was actually part of the presentation of it last year as well. So we kind of pick whoever's able to attend the conference is the one who presents. And so when I received this scholarship to go, then I was able to put my name forward as a presenter. So I presented with ACCESS-ACCES, who is a cancer researcher out of Newfoundland.
That's fantastic. I'm like so excited to hear that, honestly.
Yeah, and it's really cool to stand up and speak and share. We had a 20-minute presentation at the conference. It's very cool to stand there as someone from two very different spaces, right? And for people to hear why it's important to SevTap to have someone with lived experience to help inform her research, but it's equally important for me to stand there and say, this is why it's so important for researchers to hear our voices. So.
That is such an important message. And interestingly enough, Stephanie and I were both in a meeting today at lunchtime with a bunch of the students who are part of the summer research program here at ACCESS. And it was such a phenomenal opportunity to talk to them about exactly that, right? And they had such great questions for those of us who are PWLEs. So it gives me a lot of hope about, continuing to do this with early career clinicians and researchers too. So thank you so much.
Yeah.
What is the name of that project, Heather?
So it's put on, it's funded by the Canadian Cancer Association, or Canadian Cancer. So or Canadian Cancer Society, sorry. And it's called Reducing Silos in
Okay.
Research. Yeah.
That's really exciting.
Yeah.
Something you were talking about in your presentation that really stuck out to me was talking about what advocacy and participation brings to us, to people with lived experience, and articulating that to researchers and then trying to create the conditions to ensure that that happens. So I know that something that I feel as I move through the world sometimes is this disconnect about people with lived experience may improve the research and those outcomes for the researcher, but it should be a partnership that ensures that social capital comes back to us as lived experience folks, that we're experiencing community, we're experiencing that healing, that it's coming back to us. And that can only happen if, like you say, the conditions and us participating are present, for it to be a two-way exchange amongst us. So I really was pleased to hear that from you.
It's so interesting that you say that, because that's one thing I've talked with Capo a lot about for the last year, is that it's so important to have these safe, inclusive spaces for PWLEs. And the reason why is that we are giving something of ourselves to be there, something that's deeply emotional, and often associated to trauma, or maybe not trauma, but trauma adjacent, if it's not full-blown
Oh,
trauma.
I think it's
Yeah.
trauma.
Yeah. I just don't want to put an emotion or a burden of trauma on anybody else. But I mean, for us, it's absolutely trauma in our home. And so that is a very hard thing to do. And when you're going to learn from somebody and learn from their experiences and use it to fuel your career in a way, right? You're going to use it to inform your research, which is going to inform you as a professional, which is going to fuel who you are as a professional. You have to ensure that you are giving back to the person who is giving to you. And it doesn't have to necessarily be in a financial way, but one of the ways you can give back is by ensuring that your voice is respected and valued and heard, and that there is a safe space for people like me to come into it. And so Capo does that really beautifully, and very intentionally, which I find very profound. And, we've mentioned, and I've talked about this with Stephanie offline as well, is that not everybody is creating those spaces. But like I said before, my hope really is that Capo is an example of how we can do this for people with so that, I mean, in an ideal world, eventually we have a space where PWLEs are just as valuable and just as heard and just as significant to research as the researchers and, like I said, the people with letters after their names. And I don't want to discredit the people with letters after their names, because they're certainly doing very big, important things. But I think a lived experience can inform so much of a circumstance and a situation, and the way you are caring for patients, the way you are doing your research, and what type of research are you doing? What type of care are you providing for patients? You should be going back to the source. And I think we're thankfully moving into a time where there is more respect and value for those voices. And I just hope to see that continue to grow.
Heather, I think what you just said resonates with almost everyone that's on this call. Well, at least me, but knowing the other people whose faces I can see and whose faces I can't see at the moment, I've heard that would resonate with everyone on this call. And I think it's also something that, as we've been building the ship of access while we've been sailing it, or the cars we've been driving it, I think that exactly that is creating that space and trying to do it in a really intentionally and organic way is something that we've all been trying to come together to do, and hopefully we can continue to do that. And I fully support John and wanting you to be as involved as you're willing to be in all the things that we want.
Yes, please ask me.
Oh, good. Expect the invite as soon as we get off this call.
I think spaces like ACCESS are so important, right? And I know I mentioned that, like, if it weren't for you, I wouldn't have been able to attend this year. And so I think that's just, it's very significant to my life and to my learning as a person and as a professional, someone who wants to be a social worker in these spaces. But I also think it's really important to the people, the professionals who are there, to have people like me in those spaces.
Absolutely.
So you being able to assist with those costs of me getting there, I think is a very mutually beneficial opportunity.